Welcome, everybody. It's another edition of Coffee with Clinicians. I'm your host, Cyndi Gillum, the Director of Clinical Affairs at EO2 Concepts. And today I have the great opportunity to introduce Dr. Alejandro Zulbaran. Dr. Zulbaran is an international medical graduate and researcher in the Division of Vascular Surgery and Endovascular Therapy at Baylor College of Medicine. He's been involved in research for the past 8 years and has been invited to be a speaker as well as presenter at a variety of prestigious meetings and conferences. He has published a myriad of research studies in medical technologies and surgical techniques and drug-related research. In addition, he's also a review editor for Frontiers in Surgery, CPQ, and forgive me if I say this wrong, my French is not good, Medicine-Cient Periodique, abstract reviewer for the Symposium on Advanced Wound Care, and ad hoc peer reviewer for multiple journals. So welcome, Alejandro.
Thank you, Cyndi, and thank you for the opportunity, for the invitation, and also for the wonderful experience that has been working with you and Mark and the EO2 Concepts team.
Well, we have had a blast with you guys. I think learning so many new things. You've been in research at Baylor for a while now. And during this time, you've gotten many accolades and presented your research even globally. Very impressive. So tell me just a few highlights that are exciting for you as a researcher.
Thank you again for the hype. So I think here it's been 4 years. Sorry, not that much. I think 8 years ago I was still in med school, but it's been 4 years here at Baylor, almost 4 years. And I think that what's most exciting about being a researcher here, at least among lots of things, it's been the opportunity to collaborate in multiple studies with clinicians from different expertise. I think that has helped me personally to gain confidence in creating the first contact to propose collaboration. Over the past years, I have had the opportunity to work, in these research studies involved or being present in the operation room, like the ones we do for EO2, but also other areas like the intensive care unit or outpatient consultation. So it's a great learning in all these different areas. And another thing that I find fascinating is meeting with clinicians for brainstorming for the design of new clinical trials. I think these meetings are, again, of great learning and also of huge networking. And the learning curve of exploring these novel technologies in unknown fields is also very satisfactory, I think, especially since as a medical graduate, we don't usually have bioengineering as part of your degree, so at least here at our lab, this is a specialized field that I've enjoyed a lot to grow in.
And that's a perfect segue because iCamp is kind of unique, I believe. Tell me about iCamp and what its purpose is.
So iCamp is a consortium, or I would say a team that collaborates with multiple disciplines, either involved in surgery or clinical medicine. And the objective is to explore feasibility and effectiveness of medical technologies applied in the clinical setting, either with diagnostic or treatment purposes. The director of our lab is Dr. Najafi. He's also a biomedical engineer, and he's a huge mentor for all of us. Personally, I'm very grateful for all the support that he has given to my professional career. So through pilot studies, we integrate devices in the clinical setting. These devices are amongst a lot that we have. The list is huge, but the ones that I think we most use is triaxial sensors, electrical simulation, continuous diffusion of oxygen, of course, smart boots, watches, near-infrared spectroscopy. I mean, the list could be very long, but I think those are the most that we use. And our collaborations go from surgical specialties such as vascular, plastic, endocrine, or lung transplant surgery, to also clinical medicine such as pulmonary care, podiatry, neurology, and oncology. Today we have more than 20 ongoing studies. Wow. And a big proportion of them has integrated computer vision assessment based on machine learning algorithms for remote assessment. So I think our long-term goal is to kind of evolve from all these sensor-based to video-based assessments in those fields that are applicable. Not all of them can have this variety of assessment.
So you guys are really pushing the boundaries of technology and where it is in medicine today, and where we maybe even where we have room to improve some of those technologies as well, I would say.
So I think that the wide variety of studies and opportunities that we have here led us to expand, these techniques and to apply technologies in different ways. So it's the more you have, the more you explore,
Yeah, I love that. So you've been working on 3 studies at Baylor using CDO therapy, continuous diffusion of oxygen. Tell us a little bit about what those studies were and what you were trying to understand or search for.
Yeah, so the first study, and still ongoing, using CDO, involves the use of this technology in people with diabetes that have food complications, particularly ischemia, that undergo minor amputations, can be toe amputations or even transmetatarsal. The surgeon in collaboration with us is Dr. Jeffrey Ross. He's the chief of podiatry here at Baylor. And the objective of the study is to determine whether CDO enhances wound healing and reduces 30-day complications such as infections, wound breakdowns, or hospital readmissions. I think this study has had the slowest learning curve, but the more nourished. Because the initial protocol included using a 2x2 dressing, delivering 8 milliliters of oxygen. But then some of those wounds got a little moist, and we had to lower down the dosage and utilize a different strategy with the dressing placement. So this led us to a better patient compliance and lower withdrawals. Although the study is still ongoing, we cannot make any conclusions, but I think that all this learnership has been great with all these modifications, and especially in this population it's very complex. Then as the food study progressed and we got familiar with the device, we explored the application of CDO in patients now undergoing thyroidectomy and parathyroidectomy. We also did this in collaboration with the chief of endocrine surgery, Dr. James Oliver. Mm-hmm. And the learning curve here was faster because these procedures have very few complications, and plus Dr. Soliberg make the job easier for us, as you can barely notice the scar of his patients after 1 month. So in this study, we applied CDO over the wound post-operatively and then measured the scar length at 4 weeks. And we noticed a significant reduction of the scar length in the subgroup of patients that underwent thyroid surgery. And then we were able to present these results at some conferences, such as the Academic Surgical Congress. And then we got the opportunity to publish this study in the Journal of Surgical Research. That was in 2021. And the last study and recently completed milestone was the exploration and feasibility of CDO in women undergoing bilateral breast reduction. Here, the surgeon which helped us was Dr. Sebastian Winokur. And thanks to him, we were able to recruit participants in a very timely manner. And the wound assessments were very easy to do. He was of great support to all of us. And this study was also presented in some meetings and recently also got accepted for publication in the Journal of Surgical Research again. So we integrated different technologies for assessment in this study, particularly near-infrared spectroscopy, and I think we found very interesting patterns that will contribute to the literature, because you don't find many papers similar to these ones. So it actually was a little hard to write the discussion, but I think that's where you learn more.
So what is the overall trend that you see with CDO therapy in these studies that you've been working with?
So I think CDO can be used in many ways. So the trends can be different. I believe that the more you need it, the better it will work. So in patients with food ischemia that are compliant, the results are satisfactory. The problem is that most of them are very sick and are hard to follow up. Mm-hmm. Now, in healthy patients, the story is different, as the control group usually don't have many complications. But the results of both anterior neck and breast surgery studies that we did showed a large effect size for reproducibility in future trials.
Now, based on your experience, are there other areas that we should explore the boundaries of CDO therapy? Because there's still a lot that we don't know. And if so, what would be interesting for you to look at?
I think that we have gathered sufficient data to demonstrate that CDO is feasible and acceptable in healthy populations. I believe the next step would be to explore its use in more complex population, maybe cancer patients undergoing surgery, or perhaps open foot amputations such as GTMAs.
And then how do you think that CDO fits into the future trends of healthcare? We see a lot of technology trends, and you guys at iCamp work a lot with that. So how does this fit into that model?
Well, CDO has rich preclinical data and wide evidence for its use in diabetic foot ulcers or open wounds. I think mild open wounds. And I believe the contribution of pilot studies should encourage researchers to develop larger and longer clinical trials. Our studies have also demonstrated that CDO is acceptable for home-based self-application. So I believe that could also help to build some confidence in clinicians or researchers that decide to replicate these studies or even prescribe it in the future.
Yeah, and I think its portability allows it that greater adherence in the home-based atmosphere, which is something that we want to see as clinicians. We want people to be a lot more compliant with their therapy so they can have greater outcomes. Well, thank you, Dr. Zulbaran. I really appreciate your time, and I hope everybody has enjoyed our quick discussion and learned something new. And I look forward to seeing more of your research and working with you some more in the future.
No, thank you, Cyndi. Thank you for taking the time to do this and to spread the word of this novel technology and also showing some of our studies here and what we have done. I think it's been a great collaboration, and we're very happy to keep working with the EO2 team and explore it in different areas.
Awesome. Well, have a great afternoon. Thank you, everybody, for watching, and we'll see you next time.